how are you doing today?
Good.
Good, what's your name?
Justin.
Justin, nice to meet you. I'm Dr. Catherine. I'll be evaluating your spine today. From about the base of your head down to about your belt line, I have to expose any skin in that area. Is that okay with you?
Yep.
Sounds good. I'm going to go ahead and check the table. And then would you go ahead and remove your shirt for me? All right, and have a seat right here, face that wall. All right, and then go ahead and lay face down for me on the table. And you can go ahead and pass the seat for me. Okay, my segmental contact point was the joint line in between the ilium and the sacrum, and I was checking for anterior glide of the ilium relative to the sacrum in extension when I lifted up on the leg, and then in flexion I was checking for posterior glide of the ilium relative to the sacrum when I lifted up on the ASIS. I decided to evaluate the right SI joint because I did not feel joint play present, and during the evaluation I found a flexion restriction. All right, and if you would go ahead and cross your arms over your chest, perfect. Good. Go ahead and bend forward one more time. Good. And then if you would take one arm for me and then just okay, go ahead. All right, go ahead and cross your arms for me one more time. Good. Okay, so during the general scan of the lumbars and thoracics, I did find a restriction in the mid-thoracic spine. I bisected the scapulas and found myself around T6 area. So I contacted the interspinous spaces between T6 and T7 and had the patient flex forward and checking for a flexion restriction. I did find something in T6, so I contacted the side of the spinuses and had him laterally flex and rotate to the left and to the right, and then used a lateral to medial line of drive to check for infield. And I did find a left rotation restriction and a left lateral flexion restriction. Okay, to check the T6 rib pair, I palpated up 2 interspinous spaces and out laterally approximately an inch, and contacted the inferior angle of the rib for elevation, and my line of drive was inferior to superior. And then for depression, I contacted the superior border of the rib, and then my line of drive was superior to inferior. Checking for depression, I did not find a rib restriction. And then would you go ahead and move to this chair for me right here? And then you can prop your feet up on the table and go ahead and sink down into the chair. sit up for a second. Okay, so the restriction that I found was the C5 area, and I found that when I was contacting articular pillars and taking them into flexion, and my line of drive was P to A, and I took him into rotation and lateral bending on the right and the left, contacting the articular pillars, and then springing through the joint, feeling for spongy infill. I did find a restriction, right rotation restriction at C5. You can go ahead and set a seat. And then I did not find any further restrictions in the cervical spine.